going to see the contraindications for the thrombolytic in a patient with ST elevation myocardial infarction. So we have absolute contraindications and relative contraindications. The absolute contraindications include severe bleeding. This bleeding is usually due to a cranial bleeding or a gastrointestinal bleeding, but melena would be a relative contraindication. This type of GI bleeding is not an absolute contraindication. Then the ischemic cerebrovascular event. This cerebrovascular event, ischemic, we mean a stroke in the last 3 to 6 months. A traumatic or prolonged cardiopulmonary resuscitation, so the CPR. If the patient had a recent major surgery, let's say between 3 weeks, or if there is a known history, personal history of a bleeding disorder. And the relative ones will include severe or advanced hepatic disease or failure, pregnancy, or 1 month postpartum, and melena. So there are 3 relative contraindications, and the others are absolute contraindications, and it's just a matter of thinking if the patient has severe bleeding, gastrointestinal or cerebral hemorrhage most of the times, or a known history of a bleeding disorder. We're not going to give this to the patient. If the patient had a major surgery, we're not going to give it because the risk of bleeding. And the stroke in 3 to 6 months, maybe the patient will have another stroke.